For the first time in over a decade, the obesity rate in America has stopped growing. Could this be a turning point in one of the nation's most pressing health crises? Stay with us as we explore the latest data and what it means for the future of public health. Over 40% of adults in the United States are currently classified as obese. For years, we've watched these numbers steadily climb, until now. New data from the Centers for Disease Control and Prevention reveals that the obesity rate in U.S. adults may have finally hit a plateau. Let's rewind to the year 2000. Back then, about 30% of American adults were classified as obese, defined by a body mass index, or BMI, of 30 or higher. Fast forward 2 decades, and by 2020, that number had jumped to nearly 42%. It seemed like an unstoppable upward trend until today. According to the CDC's latest report, the adult obesity rate stands at 40.3%, using data from 2021 to 2023. While this is not a dramatic decrease from the previous years, it's the first time since 2011 that the rate hasn't increased. It may be a modest shift, but it breaks a pattern that public health experts have been monitoring for over a decade. But the story doesn't end there. Obesity isn't evenly spread across all age groups. In fact, adults between 40 and 59 years old have the highest obesity rates at 46.4%, compared to the lower rates of 35.5% among younger adults aged 20 to 39. Here's where things get even more concerning. Severe obesity, those with a BMI of 40 or higher, is still rising. In 2023, nearly 1 in 10 U.S. adults fell into this category. The risks associated with severe obesity, like heart disease, diabetes, and other life-threatening conditions, are well documented, and this trend puts even more pressure on healthcare systems. Where you live can also affect your chances of being obese. The CDC's latest state-by-state data paints a stark picture. More than a third of adults in 23 states were obese in 2023. That's up from none just a decade ago. Only 2 regions, Colorado and the District of Columbia, now boast obesity rates under 25%. It's clear that this is not just an individual issue, but a systemic one. So where do we go from here? Health experts say the focus must shift to prevention and treatment options. Communities need safer places for physical activity, and healthy, affordable food options must become accessible to all Americans. The challenge ahead is significant, but it's not insurmountable. As the obesity crisis continues, new solutions are coming to the forefront. Weight loss medications like Wegovy and Ozempic have sparked both hope and controversy. While some say they could save over 40,000 lives per year, their high cost and limited availability have drawn scrutiny. Recently, drug makers like Novo Nordisk and Eli Lilly faced tough questions in Senate hearings over the skyrocketing prices of these medications. While the battle against obesity isn't over, this pause in rising rates is a hopeful sign. But we can't stop here. The road to a healthier nation requires action from individuals, communities, and policymakers alike. As we move forward, the question remains, will we seize this moment to turn the tide on obesity, or will we let this fleeting victory slip away?